Deep vein thrombosis, commonly known as DVT, is a serious medical condition that occurs when a blood clot forms in a deep vein, usually in the legs. Recognizing the early warning signs is crucial because DVT can lead to life-threatening complications if left untreated. In this video, we'll guide you through the subtle and not-so-subtle symptoms to watch for, helping you stay informed and proactive about your health. Let's begin by understanding what DVT is and why early detection matters. DVT stands for deep vein thrombosis. It refers to the formation of a blood clot in a deep vein, most often in the lower leg, thigh, or pelvis. These clots can partially or completely block blood flow, causing a range of symptoms. If a clot breaks loose, it can travel to the lungs and cause a pulmonary embolism, which is potentially fatal. Understanding DVT's basics helps us appreciate why early warning signs should never be ignored. Early detection of DVT is vital because it can prevent serious complications like pulmonary embolism, where a clot travels to the lungs. The sooner DVT is identified, the better the chances of successful treatment and recovery. Many people may not realize they have DVT until symptoms become severe, so being aware of early warning signs can truly be life-saving. Certain factors increase your risk of developing DVT. These include prolonged immobility, such as during long flights or bed rest, recent surgery, pregnancy, obesity, smoking, and a family history of blood clots. Knowing your risk factors can help you stay vigilant and seek medical advice if you notice any warning signs. One of the earliest and most common warning signs of DVT is swelling in one leg, typically in the calf or thigh. This swelling may develop gradually or suddenly and is often noticeable compared to the other leg. The swelling occurs because the clot blocks normal blood flow, causing fluid to build up in the affected area. Pain or tenderness in the leg, especially when standing or walking, can be an early sign of DVT. The pain may feel like a cramp or soreness and is usually localized to the calf or thigh. It's important to note that the pain may not always be severe, but any unexplained discomfort in one leg should be taken seriously. Another early warning sign of DVT is a change in skin color over the affected area. The skin may appear red, bluish, or even pale compared to the other leg. This discoloration is caused by reduced blood flow and inflammation around the clot. If you notice any unusual changes in skin color, it's important to seek medical advice promptly. A feeling of warmth in the affected leg is another early sign of DVT. The skin over the clot may feel noticeably warmer to the touch than the surrounding areas. This warmth is due to increased blood flow and inflammation as the body reacts to the clot. Always pay attention to any unusual sensations in your legs. Tenderness or sensitivity in the leg, especially along a vein, can be an early indicator of DVT. This tenderness may be present even without obvious swelling or redness. It's often felt when pressing on the affected area or when moving the leg. Don't ignore persistent tenderness, especially if you have risk factors for DVT. While swelling, pain, discoloration, and warmth are the most common early signs, some people may experience less typical symptoms. These can include a heavy or aching feeling in the leg, mild fever, or even visible veins that seem more prominent than usual. Every individual's experience with DVT can be different, so it's important to be aware of all possible warning signs. It's important to note that some cases of DVT may not cause any noticeable symptoms, especially in the early stages. This is known as silent DVT. That's why understanding your risk factors and staying alert to even minor changes in your legs is so important. Regular checkups and preventive measures are key for those at higher risk. Sometimes, DVT symptoms can be mistaken for a muscle strain or injury. However, DVT pain is usually persistent and not relieved by rest or over-the-counter painkillers. If you have risk factors for DVT and experience unexplained leg pain, it's better to err on the side of caution and consult a healthcare professional. A major danger of DVT is that a clot can break free and travel to the lungs, causing a pulmonary embolism. This is a medical emergency. Warning signs include sudden shortness of breath, chest pain, rapid heartbeat, or coughing up blood. If you experience these symptoms, seek immediate medical attention. DVT can affect anyone, but certain groups are at higher risk. These include people over 60, those with a history of blood clots, individuals with cancer, and those who are immobile for long periods. Women who are pregnant or taking hormone therapy are also at increased risk. Knowing your risk profile can help you take preventive steps. Long-distance travel, especially flights over 4 hours, can increase your risk of DVT due to prolonged sitting and limited movement. It's important to take breaks, stretch your legs, and stay hydrated during travel. Simple actions like flexing your feet and walking around can help reduce your risk. Pregnancy increases the risk of DVT due to hormonal changes and increased pressure on veins. Pregnant women should be aware of the warning signs, especially if they notice swelling, pain, or redness in one leg. Regular prenatal checkups and following your doctor's advice can help prevent complications. Recent surgery, especially orthopedic procedures, can increase the risk of DVT. This is due to immobility during recovery and changes in blood flow. Hospitals often use preventive measures like compression stockings or blood thinners for at-risk patients. Always follow your doctor's post-surgery instructions. Obesity is a significant risk factor for DVT. Excess weight puts additional pressure on veins, making it harder for blood to flow properly. Maintaining a healthy weight through diet and exercise can help lower your risk of developing DVT and other related complications. Smoking damages blood vessels and increases the risk of clot formation. Smokers are at a higher risk for DVT compared to non-smokers. Quitting smoking is one of the most effective ways to reduce your risk and improve your overall vascular health. A family history of blood clots or genetic clotting disorders can significantly increase your risk of DVT. If you have close relatives who have experienced DVT or pulmonary embolism, discuss your risk with your healthcare provider. Genetic testing and preventive strategies may be recommended. Hormone therapy, including birth control pills and hormone replacement therapy, can increase the risk of DVT, especially in women with other risk factors. If you're considering or currently using hormone therapy, talk to your doctor about your personal risk and possible alternatives. Cancer and certain cancer treatments can increase the risk of DVT. Tumors may press on veins, and some treatments can affect blood clotting. Cancer patients should be especially vigilant for early warning signs and follow their healthcare team's recommendations for prevention. If you or your doctor suspect DVT, diagnosis typically involves a physical exam, blood tests like dimer, and imaging studies, such as ultrasound. Early diagnosis is key to preventing complications. If you notice any warning signs, don't hesitate to seek medical attention for proper evaluation. Preventing DVT involves staying active, maintaining a healthy weight, avoiding prolonged immobility, and following your doctor's advice if you have risk factors. Wearing compression stockings and staying hydrated can also help. Prevention is always better than cure, especially for those at higher risk. If you notice any early warning signs of DVT, such as swelling, pain, redness, or warmth in one leg, seek medical attention promptly. Early treatment can prevent serious complications. Don't ignore symptoms, especially if you have risk factors or a family history of blood clots. If left untreated, DVT can lead to serious complications such as pulmonary embolism and post-thrombotic syndrome, which causes long-term pain and swelling. Recognizing early signs and seeking timely treatment can help you avoid these potentially life-altering outcomes. Older adults are at higher risk for DVT due to decreased mobility, chronic illnesses, and age-related changes in blood vessels. Family members and caregivers should be aware of the warning signs and encourage regular movement and medical checkups for elderly loved ones. While DVT is more common in older adults, young people are not immune. Risk factors like oral contraceptives, smoking, and genetic predisposition can affect younger individuals. Awareness and healthy lifestyle choices are important for prevention at any age. Regular physical activity helps keep blood flowing and reduces the risk of DVT. Even simple exercises like walking, stretching, or leg lifts can make a big difference, especially for those who sit for long periods. Incorporate movement into your daily routine for better vascular health. Staying hydrated is an easy and effective way to lower your risk of DVT. Dehydration can make your blood thicker and more likely to clot. Drink plenty of water throughout the day, especially during travel or periods of immobility. Compression stockings are often recommended for people at risk of DVT. They help improve blood flow in the legs and reduce swelling. If you have risk factors or a history of DVT, ask your doctor if compression stockings are right for you. For those at high risk, doctors may prescribe blood thinners or anticoagulants to prevent clot formation. These medications require careful monitoring and should only be taken as directed. Always discuss the risks and benefits with your healthcare provider. Hospitalized patients, especially those recovering from surgery or illness, are at increased risk for DVT due to immobility. Hospitals use preventive measures like early mobilization, compression devices, and medication to reduce risk. Patients and families should be aware of warning signs during and after hospital stays. Chronic illnesses like heart disease, diabetes, and cancer can increase the risk of DVT. Managing underlying health conditions and following your doctor's advice are essential steps in reducing your risk. Regular checkups and monitoring are especially important for those with chronic diseases. People in long-term care facilities are at higher risk for DVT due to limited mobility and other health issues. Caregivers should encourage movement, monitor for warning signs, and ensure preventive measures are in place. Early detection and intervention are key in these settings. Individuals with physical disabilities may have an increased risk of DVT due to reduced movement. Adaptive exercises, physical therapy, and regular monitoring can help lower the risk. It's important for both individuals and caregivers to be aware of DVT warning signs. Certain medications, such as hormone therapy, chemotherapy, and some antidepressants, can increase the risk of DVT. Always inform your doctor about all medications you're taking and discuss any concerns about blood clot risk. Dehydration can make your blood thicker and more likely to clot, increasing the risk of DVT. Make it a habit to drink enough water every day, especially during hot weather or when you're ill. Hydration is a simple but powerful preventive measure. Air travel poses a unique risk for DVT due to prolonged sitting and cabin pressure. To reduce your risk, stand up and walk around periodically, stretch your legs, and stay hydrated. Consider wearing compression stockings if you have additional risk factors. People with desk jobs or sedentary lifestyles are at increased risk for DVT. Make it a point to stand, stretch, and walk every hour. Simple desk exercises and regular breaks can help keep your blood flowing and reduce your risk. Sports injuries, especially those requiring immobilization, can increase the risk of DVT. If you're recovering from an injury, follow your doctor's advice on movement and preventive measures. Watch for warning signs like swelling or pain in the affected limb. Varicose veins can increase the risk of DVT due to poor blood flow. If you have varicose veins, monitor for warning signs and discuss preventive strategies with your doctor. Compression stockings and regular movement can help manage risk. Certain infections can increase the risk of DVT by causing inflammation and changes in blood clotting. If you're recovering from an infection, be aware of DVT warning signs and follow your healthcare provider's recommendations for prevention. Healthy lifestyle choices, such as regular exercise, balanced diet, and not smoking, can significantly reduce your risk of DVT. Small changes in daily habits can have a big impact on your vascular health and overall well-being. Deep vein thrombosis is a serious condition, but early warning signs can help you catch it before complications arise. Watch for swelling, pain, redness, warmth, and any unusual changes in your legs, especially if you have risk factors. Stay proactive about your health, follow preventive measures, and consult your doctor if you notice any symptoms. Early detection saves lives.